So the chokehold death of Jordan Neely is forcing city and state leaders to look at ways to prevent people in need from falling through the cracks. 30-year-old Neely had been placed on the Department of Social Services top 50 list, which targets the neediest individuals for mental health support.
His death is clear evidence that we need support. We need alternatives for these individuals so they're not relegated to that kind of life. So those of us in government, it is a wake-up call. It is saying society's frayed right now, our people are hurting, and shame on us if we don't step up and say, no, we're here to help. We can do something. We have the resources. We just have to dedicate them to the services that we know will work over time.
So Governor Hochul's state budget makes a $1 billion investment in mental health services. Joining us this morning is the New York City Health Commissioner of Mental Hygiene as well, Dr. Ashwi Vasan, to discuss the steps the city is taking to address the mental health crisis and more. We're going to talk about window guards and the safety there in just a minute, but good to have you here in studio.
Thanks for having me.
So let's talk about this right now, because there's a lot of talk once again about mental health in the forefront because of the headlines. Any additional insight, I guess, as the health commissioner, that you can provide about this top 50 list that we're now hearing about, which is supposed to be this approach from multi-agencies? Is the list public knowledge?
We would never make a list like that public for privacy reasons and safety reasons for the people we care about and the members we serve, the clients we serve. Right. But we have recognized for a long time that there's a subset of people living with really severe mental illness, often substance use issues as well, and complex social needs, where the city has taken a view of how can we get them more resources, more care, and also how can we prevent them from landing in such a spot where they have so many needs, which is why we launched the mental health plan we did in March.
Yeah, and Governor Hochul just invested $1 billion in mental health services. How is that going to help?
It's a big help. First of all, it recognizes that our mental health system in New York City is a team sport. Yeah. It's a product of city funds, state funds, and policies, and federal funds. That $1 billion is going to go to massive investments into supportive housing, but also expansion of things like mobile teams, crisis respite centers. These are all critical foundational building blocks of a system that can treat the most severely impacted. And it's the system that we've divested in or disinvested in over decades, but now we need to start building back.
I guess help us understand how somebody ends up on the top 50 list, right? How are you tracking? And like for somebody like Jordan Neely, who now the reports are that he was on the list, how do you know somebody is on the list?
We look at people that have complex needs and volume of interactions with our services, or complexity of interactions with our services. And so that's part of what we look at, but it's not, it's not about strict criteria on or off. It's really about who are the clients that we are finding are really challenging to serve because of the complexity of their illness and their social needs. Let me just be clear. The circumstances of Mr. Neely are a tragedy. Yeah. An absolute tragedy. No one should die with a mental illness, an untreated mental illness. And I want to just make that really clear. His death is in part a product of a broken mental health system that we've not invested in. But I am proud to be a part of an administration that, and a mayor who's made this an issue from day one, that hasn't been reactive to a tragedy, but said from the moment I got elected, I'm going to make serious mental illness and our mental health system a priority, as well as the governor.
Yeah, well, here's part of the problem, though. Not all homeless folks that are on the street are willing to accept the help. But when they do, are there enough beds to even serve them? And will this investment, this new investment, help to put more beds in the hospitals?
I think that's exactly what we're trying to do. More beds in hospitals, reopening beds that were closed in COVID. I know our colleagues at Health and Hospitals are working hard to do so by the end of the year. But also not just hospitals, but really looking at other destinations, expanding things like clubhouses, crisis respite centers, our transitional housing and care centers, peer-based programs. There's a whole host of options that we need to really build up year by year, budget cycle by budget cycle.
We could talk about mental health for quite some time, because it's really been in the it's not only been a conversation that's happening now, it's been happening over decades, and it's finally having the investment that it's needed. So you're playing catch up really to a decades-long problem.
I think that's right. I think ketchup is a way to characterize it.
But I want to talk about the other reason you're here today, and that is safety in homes, right? I often think about a health commissioner, and you think about illness, but there's really a lot that you focus on. And last week we saw this tragedy, right? The two toddlers that fell out of windows, one in Chelsea, the other in Queens. You know, I guess for you as the health commissioner, what is your role in kind of advocating for this kind of safety here?
Well, window guards and window safety and home safety is a core part of public health. Making the home a safe environment, especially for children, is a core public health issue, and it's an issue that lives in our health code and in regulations all across this city. Every child that has a fall through a window is a preventable tragedy, a preventable incident. But through window guards, we've been able to reduce that by over 90% since the 1970s. We used to have hundreds of kids falling out of windows every year. Now we're down to like tens or less. And so we got to keep pushing, keep holding landlords accountable for putting in window guards. If you aren't getting any response from your landlord, call 311. We'll make them respond. This is part of the law. They have to install window guards.
So is there a proper way to make sure that you put it in correctly that you can show us real quickly?
Absolutely. So this is a prop window we have. Number one, the window guard itself needs to be a sturdy material, preferably metal. Number two, no space in the window guard can be greater than 4.5 inches, which is the minimum circumference we estimate of a baby's head. It has to be mounted inside the window. And as you see here, we have also window stops that prevent the window from opening up more. So the window guard, in addition to the window stops, is required by the law. If you have an air conditioning unit, that has to be permanently mounted in, so with either wood or metal around the frame. And burglar bars, the kinds of bars that come out, those are not a substitute for a window guard. And window screens are also not a substitute for a window guard.
Because I think sometimes people think that, while they're there, that's enough.
And both the stops and the guards provided by the city, free to anybody.
Yeah, we can certainly help. It is a landlord responsibility, though. So if your landlord is the city, obviously we will help. If your landlord's a private landlord, they have to do this by law. And if they're not doing it, call us. Call 311. We'll help.
Dr. Vasan, thank you so much.
Thanks so much for having me.
Appreciate your time.